Spencer. I'm going to be your nurse today. We're going to do a quick musculoskeletal exam, if that's okay. Okay, so during this exam, I'm going to be looking overall at your muscle and bone strength and range of motion, as well as any like your symmetry, size, shape, and any kind of deformities I might see. So we're going to get started. We're going to do your jaw first. If you can open and close your mouth. Okay, now move your jaw left to right. Good. Now we're going to do your neck. So if you could put your chin to your chest, straight, and then all the way back. Good. Put your ear to your shoulder. Okay, other shoulder. There you go. Then you're going to rotate your head, both sides. Okay, good. We're going to move on to your shoulders. You put your arms above your head and flex. Okay, put them down at your side. Now we're going to abduct. You're going to put your arms out like this. And back down at your side. Perfect. Now we're going to do internal rotations. You're going to put your arms behind your head. Good. Now you're going to put your arms behind your back like this. Good. Now I'm going to test your muscle strength. So put your arms back out like this. Okay, don't let me push down. Don't let me push up. Good. Now we're going to move on to your elbows. So if you can flex your elbows like this. Okay. Now we're going to extend your elbows. Perfect. Now we're going to put your arms in supine position, supinate, and then you're going to pronate. Perfect. Okay, now we're going to move on to your wrists. So we're going to do something called balance test, which checks for carpal tunnel. So you put your wrists together like this. Perfect. Do you feel any kind of tingling or numbness when you do that?
No.
Okay, good. Now we're going to do something called Tinel sign. So I'm going to take your wrist, tap on it. Do you feel any kind of numbness or tingling?
No.
No?
No.
No? Okay. Now I want you to flex your wrist down like this. Okay. Then I want you to put them out straight. Straight. There you go. Now you're going to put them all the way up and hyperextend. Perfect. Now we're going to do a rotation. So you're going to put your arms out like this. You're going to rotate like this. I'm just trying to make room so you have room. You're going to rotate them in. This is called the ulnar rotation. And you're going to move them out. I'm sorry. This is radial rotation, and then this is ulnar rotation. Okay, good. Now we're going to do your hands. So if you could take your hands and close them like this. Okay. Now you're going to extend your hands all the way back. Good. Now make fists. Good. Now I want you to abduct your fingers. You're going to separate them all out. Okay. Adduct, put them back together. Good. Okay. Now we're going to move on to your hips. So if you could take your leg and you're going to put it, extend it out like that. Good. And you put it back, all the way back. It's hyperextension. Good. Now we're going to abduct your legs. So you're going to go out like this and back in. Okay. Now you can bend your knee and rotate it outwards like this and back towards the middle. Good. Now we're going to do the other side. So you're going to bring it forward and go all the way back. Good. Now you're going to abduct. Yeah, there's a little detail behind the cake there. Okay. Now you're going to abduct. So you're going to move it out, back towards the middle. Good. Now you're going to bend your leg, rotate it out, rotate it back towards the middle. Good. All right, so I'm going to have you sit on the bed. You're going to do your knees now, so you can straighten out your legs for me. Okay, now bend them again. Bend them. There you go. Now we're going to do your feet, so you're going to do dorsiflexion, so point your toes towards your knees. Okay, now point your toes towards the ground. Good. Now we're going to do an internal rotation, so I want you to turn your feet inwards towards each other. Good. Now outwards is an external rotation. Good. Okay. Now we're going to do your toes. Can you clench your toes for me? There you go. Now straighten them out. Good. Okay, stand back up. Now we're going to do your thoracic and lumbar spine. So can you bend over and touch your toes? Okay, stand back up. Now I want you to lean back. Okay, good. Now I want you to move laterally, so you're going to move side to side. So one side, go. Other side. Good. Now we're going to do a rotation. So I just want you to rotate your body one way and then the other way. Okay. Good. So your range of motion is good. Did you have any pain or discomfort with anything of that?
No.
Okay. When I tested your shoulder strength, it was a strength of 5, which is normal. Do you have any questions?
No.
Okay, I'll let your doctor know that everything looked normal.
Thanks.